New evidence is giving teens even more of a reason to stay fit. Research shows that men who are overweight or obese as teens have a higher rate of colorectal cancer by the time they reach middle age. Researchers in the U.S. and Sweden kept track of men who signed up for the Swedish military when they were between the ages of 16 and 20. Of those teens, more than 2% were overweight. That group was studied for 35 years, and those who were overweight at the time of enlistment were more than 2% more likely to develop colorectal cancer later in life than those who were normal weight. The researchers say it's not yet clear what the link is between being an overweight adolescent and developing cancer later in life, but more research will be done to try and find the link. They also caution that the same results might not translate to women. A separate study showed that obese women are 40% more likely to develop some kind of cancer later in life. The study was published in the journal Gut. Colorectal cancer is more likely to occur as people get older. More than 90% of people with this disease are diagnosed after age 50. The average age of diagnosis is 72. The specialists at Advanced Gastroenterology and Surgery Associates explain how colonoscopies play an important role in early detection.
Colonoscopy screening is extremely important. And I think it's important to note that colon cancer is the second most common cause of cancer death in the country and the third most common cause of cancer in men and women. And most patients are reluctant to have the procedure performed. Colon cancer develops from an ingrowth of the lining of the mucosa, what we call a polyp. And there are certain types of polyps, the ones that are adenomas, that can grow and eventually turn into colon cancer. It's important to note that the adenoma cancer sequence takes approximately 6 to 10 years. So every patient that we see with colon cancer, they've had a polyp growing in them for a long time, which can be prevented because when we do colonoscopies, we remove polyps. Now, of course, there's some colon cancers that may develop a little bit more rapidly, but the average time interval is 6 to 10 years. So it really is a preventable form of cancer.
Colonoscopy is again using the fiber optic technology there to be able to look at the entire colon. Colonoscopies are very, very important. First, right off the bat, why? Is because it's very important for being able to detect malignancy. And colon cancer is very preventable if we are able to diagnose it before it gets there. It just so happens that a person does have colon cancer. If it's small enough and it's not spread, then it's treatable by surgery.
We start screening at the age of 50. And if that person has no polyps or they have what are called hyperplastic polyps, then the recommended next screening interval is in 10 years. Or if someone has a family history of colon cancer, then we usually start in the 40s or 10 years before the youngest age of the person affected. For instance, if someone has a family member that was diagnosed with colon cancer in their 40s, then that person should start in their 30s.
According to cancer.gov, a higher BMI is strongly associated with increased risk of colorectal cancer in men. The distribution of body fat appears to be an important factor, with abdominal obesity, which can be measured by waist circumference, showing the strongest association with colon cancer risk. One hypothesis as to why high levels of insulin or insulin-related growth factors in obese people may promote colorectal cancer development. High BMI is also associated with rectal cancer risk, but the increase in risk is more modest. For more information on colonoscopies, as well as other treatments and surgical procedures available at AGSA, please click the BMI and colon cancer story link on our homepage, yourhometownhealth.com.